You are listening to the Special Needs Children podcast with Chitra Iyer. Chitra Iyer is a parent of 24-year-old Shravan Iyer who has epilepsy, cerebral palsy and autism. She is the CEO of MFA and has been helping families with life-centered planning to reach their personal financial goals. She is also a trustee of a parent support group, the Forum for Autism, which was set up almost 2 decades ago. MFA is a 17-year-old organization working in the personal finance space. They have set up a dedicated practice to help families with special needs children to plan their financial goals and invest for them. The thoughts shared here are a result of the discussion with parents, caregivers, siblings and professionals regarding the planning of a person with special needs. In this expert series podcast, Chitra Iyer is talking to Dr. Pradnya Gadgil, a pediatric neurologist and epileptologist who is very passionate about her work with children who have epilepsy. With her vast experience in complex pediatric epilepsy in India and UK, she has run several programs to help increase awareness and treatment services for children with epilepsy. In this interview, she has shared about her role as a pediatric neurologist and explained in simplistic terms about epilepsy, its management and information on services available for children in Mumbai.
Hello everyone. A big warm welcome to all of you on this expert series of my podcast for special needs children. Today I have with me a dear doctor who I really look up to, Dr. Pradnya Gadgil. She's been an amazing beacon of hope and somebody I have really watched over the last decade plus and has seen how she has been doing her work consistently, religiously, reaching out to so many people. Thank you so much, Dr. Pradnya, for your time today.
Thank you, Chitra. It's an honor and a pleasure to be with you here.
Yeah, thank you. Thanks for agreeing to do this interview with me. Just to introduce you to our listeners, Dr. Pradnya Gadgil is a pediatric neurologist. Having done her subspecialty training in complex pediatric epilepsy from India and UK, she is extremely passionate about working with children with epilepsy. Along with clinical work, she has been a teacher in pediatric medicine and pediatric neurology at Sir J.J. Hospital and Kokilaben Dhirubhai Ambani Hospital. Currently, she is attached to the SRCC Children's Hospital run by Narayana Hridayalaya in Mumbai, where she has set up a dedicated and state-of-the-art pediatric complex epilepsy service. This is a center which offers epilepsy surgery to the youngest of babies and also has a program that caters to the financially weaker section of the population. I'm starting straight with my questions to you, Doctor. Can you please share your story about your journey as a neurologist? How and why did you choose to become one and especially to look after babies?
Chitra, you're starting off with a bouncer question. All through our medical interviews, all job interviews, we are asked this question: why pediatrics? Why neurology? And I honestly have to confess, I didn't know the answer early on. But I think now looking back, I think working with children is almost a blessing to the people who work with children. It's so gratifying. It also teaches us a lot. Kids have the best perspective on life. So instead of, sometimes it feels like the kids are teaching us more than what we are giving them. So pediatric medicine, I think, just naturally had aptitude, just loved working with kids. And then neurology came along because neurology is one of the most logical subspecialties of medicine. It's also very, very intriguing and very, very challenging. So I think the academic challenge of it, not knowing what would walk through your door next, what sort of a difficult clinical conundrum it's going to be, was also very, very attractive.
Lovely. Can you please share with us about, where all did you study and what all did you do? And, you've also been across the world, right?
Yeah, I'm not across the world, but so I'm a Mumbaikar, born and brought up in Shivaji Park. So did all my schooling in the usual suspects, King George and Ruparel and so on. I did my medicine in Nair Hospital. Uh, then I had a choice of staying back in and doing post graduation in Mumbai or going abroad. And this was the time when you're young and restless, a little bit disillusioned with the medical education system. And thankfully, I got cleared exams and got the opportunity to go to UK. So then I was there for almost 9 years, did my pediatric training, then trained in pediatric neurology, and then ended up with training in complex epilepsy and epilepsy surgery. Along the way, again, I think you start asking more questions as you grow older. So I always wanted to come back home, but there was a big question whether, having done so much training in UK in their medical system, uh, uh, would coming back home do justice to my training, and also can I do justice to the pathology and the challenges that we see here. So in between, I worked for 2 years with Dr. Rajesh Udani as his fellow in Hinduja. And I think that also helped to give a much larger vision of the world, not just the medical part of it. So after all that training got over, I went back to UK, did complex epilepsy, and then came back to Mumbai. Was working with Kokilaben Ambani Hospital, was there for about 9 years, and have now recently joined SRCC Children's in Mahalakshmi in Mumbai.
So, how do you feel India has progressed, in the last decade? Since you started practice, I mean, couple of decades now, since you started studying and then you started practice in this, specifically in the field of neurology. I know you've been part of some path-breaking projects, right? Can you please share about the same with us?
So India, from the time I came back the first time and today, the journey that you see, especially with respect to child neurology, is incredible. I'm just going to take a minute to talk about child neurology. So remember, just give you some context. So pediatric medicine for the longest time wasn't looked upon as a different specialty across the world and of course in India. About 50 years or so ago, pediatric medicine started being recognized as a different specialty. Is that important? Yes, it's very important. Pediatric bodies, pediatric brains, they aren't just little adults. You just can't, do a mini version of everything that you do for adults. So having a dedicated pediatric medical specialty is critical to be able to deliver the right kind of care to kids. Then comes the question of pediatric subspecialties. That has really, really lagged behind the rest of the world. Till about 5 years ago, our medical council only recognized one subspecialty, that is neonatology, looking after newborn babies. That was the only subspecialty recognized by our medical council. So when you don't have administrative recognition, then the whole development of that subspecialty, the training, the infrastructure that's required for it, everything really, really lags behind. So the biggest change I think I've seen, and that's come about after a lot of advocacy by professionals in those fields, but it's come about in the last 5 years, where now our medical council recognizes pediatric gastroenterology, pediatric neurology, pediatric endocrinology as subspecialties. And I think that probably, though it's silent, it doesn't figure in any newspaper articles, but I think that will be a key to further development of these specialties in India. So far, we only had people who are trained abroad coming back and then practicing that subspecialty. So now we have training. We have now pediatric neurology, DM. We've just, this year, we have a DNB in pediatric neurology. So now we'll have Indian doctors trained in India in these subspecialties. And I think that is probably going to be the biggest game changer in the long term, especially in the world of pediatric medicine in India. Apart from that, I think there has been a lot of advocacy that's come in. you've worked with autism advocacy. I along with Indian Epilepsy Association, we are trying to work for advocacy for epilepsy. A few years ago, talking about these things was also very difficult. There would be all of that would be mentioned in whispers. It wasn't something that you talked about openly, let alone advocacy. So now I think those barriers are breaking. That taboo, that social stigma is slowly, there's still a lot of work to do, but it's sort of going away. And now we are able to talk about making provisions in the law, provisions in the education system, and generally start working towards an inclusive kind of an environment for children with different pediatric neurological problems. And I think that's a big change. Like 10 years ago, I would struggle to help my families find schools which would accept their kids. Now, very often, at least in the major cities, I'm able to give them a list of few names which have the potential to accept and work upon their kids. I don't know what path breaking, Chitra, but a few projects I've been involved with just reflect this change. So we started a child development center in Kokela in Ambani Hospital. So that, of course, involved providing all the usual services like physiotherapy, occupational therapy, but dedicated to pediatrics. When I was setting this up, I said we need a special educator, we need a teacher to be part of it. And I can remember most of the administrative team I was talking to looked at me saying, is she in her right mind? Why do you need a teacher in the hospital? But we were finally able to convince them. We got special educators on board, because you and I know that, rehabilitation isn't only about physical therapy. It has to be very all round. We were also able to start a hospital school in the hospital. So we had so many patients who were coming for their treatment for cardiac diseases, for cancer, who would be there for 2 weeks, 3 weeks, sometimes months. Otherwise, they would just be sitting watching TV and mobile. So we started a hospital school in the pediatric ward, so that their time in the hospital, they didn't compromise on that overall development. And I think surprisingly, it was one of the most popular schools around. Kids would look forward to come for it. Parents would eagerly send their kids to that school. So these are, of course, little things, but just the journey towards getting that to happen, seeing people's reaction and then seeing their acceptance teaches us a lot. Other thing I'm proud of having been involved with is my work with the Indian Epilepsy Association. We started this two main campaigns which are very dear to my heart. One was this rural camps for epilepsy patients. So what a challenge that was, Chitra. So we selected Dahanu as our first outreach. This is a place where there are a lot of people are tribals. Yeah. They don't communicating to them. They don't have mobile phones. They don't reach out to each other in ways that we sort of take for granted. Then there's a huge mistrust in allopathic medicine. And generally, there is that attitude saying, "ठीक है, ये मेरे नसीब में है, ये मेरे बच्चे को है, I have to live with it." So overcoming all these barriers was such an interesting challenge, and I'm so happy to say that now the Dahanu epilepsy camp has been running for 5 years now. We have almost 200 patients, adult and pediatric, attending the camp regularly. Plus, we have a regular intake of newly diagnosed patients who come in. And it has now grown to, especially for pediatrics, we take physiotherapists, occupational therapists. So they not just managing the epilepsy, but also the other developmental concerns are starting to get addressed. And it's amazing how these families, they don't have they have no real connect with tech. They have heard of the word therapy or medications or epilepsy possibly for the first time. But the way they comply and then the way they learn therapy and implement it. And so we have tracked the improvement in patients. And it's just very humbling to see what these families can do. We see them every 4 months, but they sort of diligently follow everything that has been told to them and how the kids improve. A lot of them have started going to school if it's available, but they've just sort of just started coming out of that bubble that they were being kept in because they had epilepsy or developmental issues. So the inspiring bit is how they take it on with with what I would think very minimal intervention from our side, and even that how that little goes a long way in improving not just the medical care but the quality of life for that child and that family. The second project that was very close to me was teachers' epilepsy awareness. So when I came back from UK, again, let me give a little bit of context here. UK and most other developed countries have a law around most childhood disabilities, whether it's autism, cerebral palsy, learning difficulties, epilepsy. They have a written sort of a guideline as to how schools are supposed to handle these kids, how they can help them. And the guiding principle is being inclusive, but at the same time, making sure that the child's needs are met. However, when I came to India, I would find that, I would tell the families, of course, talk to your school that your child's been diagnosed with epilepsy. This is the emergency treatment to be done. Majority of the time, parents would not talk to school. And there were no real answers saying why not. And they were worried, either they felt ashamed or they were worried that the child would be excluded because of the diagnosis of epilepsy, or they just didn't feel that they were encouraged to be open about these things. And we realized that this is all sort of linked to the lack of awareness about epilepsy amongst in the school environment. And the school environment is just a mirror of the rest of the society. People, there's a lot of epilepsy has so many myths, so many misunderstandings still in our general society, and the schools and teachers are just part of it. So we started with an epilepsy awareness program for schools and teachers. So initially, our volunteers would call schools, say ki we have a doctor who would like to come and talk to you. You please give us time. Some schools accepted, some didn't. So I would go to schools and small, big, whatever, municipal school, private school, whatever, and go and talk to teachers and talk to them about epilepsy, tell them about what's learning difficulty, what's ADD, how can they practically handle a child who has seizures, what's the first aid, can they take them to picnics, and so on, all the practicalities around it. And slowly that grew. And during COVID, we managed to reach out to BMC. BMC has about 10,000 teachers on their roll. That's a Mumbai municipality. So, of course, but it was COVID, so we couldn't meet in person. So every Thursday we would have a Zoom meeting, and the BMC would get their teachers ward-wise, and they had to attend the Zoom. And those were incredibly amazing meetings. It would go on for 2 hours. I would talk about epilepsy, and then it was interactive Q&A kind of a session where teachers would ask whatever questions they had around childhood epilepsy, managing those kids in school, the financial aspects, the social aspects, their own worries around it, and the comorbidities of epilepsy, the attention deficit, the learning difficulties, and so on. And so we managed to reach out to almost 8,000 teachers through COVID. And we collected data. We had a Google form they had to fill in before and after the talk. One was to understand what is the pre-existing awareness around epilepsy, and the second one was to say, are we really making an impact? There's so much effort, so many people are working towards it. Are we making an impact? So we will publish it very soon, but it was very interesting, Chitra. Almost 85% teachers in the pre-talk survey said that epilepsy first aid includes naak ko kanda lagao, chappal sunghao, kind of a thing. So that's just one statistic as an example to demonstrate the tremendous misunderstandings around epilepsy in the society. And then we were thankfully able to reverse those same questions. A majority of them thankfully answered the right way at the end of the talk. So these are a couple of projects that I'm very, very proud of. Of course, a lot more needs to be done. This is just Mumbai, just the Mumbai municipality schools. But I think they reflect the huge gaps. One is around awareness, and the second is around the treatment. And we need to keep plugging on about it to ensure we start closing those gaps to an extent.
I think, Pradnya, you just being very, very, very modest. Um, all that you shared was absolutely amazing. I mean, the first biggest one, I actually didn't know that the medical council didn't have anything to do with pediatric medicine till, this recently. This is really shocking to know. And thank God that it's here, as you said, right? It must have really helped in so many hospitals going ahead and actually having their own pediatric wings now.
Yeah, absolutely. Absolutely.
I mean, it's as recent as just 50 years, you said?
Yeah, so it was Dr. Udani's father who was one of the early teachers who started that movement. But, I can imagine what a struggle it must have been for them to sort of get this concept through. So
Yeah.
as recently, so when I was associated with JJ, I was still a associate professor in pediatric medicine, not pediatric neurology. Uh,
Hmm.
because so that but hopefully that percolates, it sort of starts at the top and then those changes will percolate. So but that initiation is the most important thing to bring about that change. So slowly and surely I'm very confident that will happen. The ball has been set rolling by our teachers, and so many others in the Association of Childhood Neurology has had a big role to play in getting this to actually the recognition to come about on paper. Everybody
Wow.
knew about it, obviously even a lay person knows that ye brain ka bimari hai ya ye liver ka bimari hai. The lay person knows that, but getting that recognition and then developing those services is so important.
That's absolutely amazing. I'm going straight to therefore, the root cause of, what you do day in and day out. What is epilepsy? How is it diagnosed? And, it manifests with other neurological problems in children today. So if you could please tell the listeners that what are they supposed to look out for, and how is it treated? How do you manage, children? And there could be epilepsy in just anyone, and then there is epilepsy with disability. So can you please answer this?
Surely. So epilepsy is a topic very, very close to my heart. So I can go on and on about this. So what is epilepsy? Again, I'm going to try and give a little bit context here, because this is one disease which gets very frequently misdiagnosed or misinterpreted even by medical professionals. So if we all know, the brain is like a very, very intricate network of electrical circuits. So if there was to be a short circuit in part or most of that network, then what you see on the outside is what we call an epileptic seizure. So short circuit inside the brain, outside you see an epileptic seizure. The look can be very, very varied. It can be very dramatic, as they show it on TV, the whole body jerking, falling down, saliva coming from the mouth, sometimes even blood coming because there's been a tongue bite, eyes rolled up, a very disturbing look, to a very, very subtle look where the child or the adult might be sitting next to you. They just get lost for a few seconds and you wouldn't know unless you were paying attention. So the look of the epilepsy is very, very varied, right from the very subtle to the very visually dramatic and disturbing. But all of those, what they mean is that there's a short circuit happening in the brain. Now, if this short circuit happens because there has been a sudden problem that's happened in the brain, अचानक ब्रेन को धक्का लगा है, फॉर एग्जाम्पल रोड ट्रैफिक एक्सीडेंट हुआ है, या छोटे बच्चों में या बड़ों में कैल्शियम कम हुआ है, शुगर कम हुई है, सो वो केमिकल का ऊपर नीचे हुआ है, या अचानक ब्रेन में ब्लीडिंग हुआ है या ब्रेन में इन्फेक्शन हुआ है, तो तभी भी शॉर्ट सर्किट हो सकता है ब्रेन में and you can experience an epileptic seizure. But those seizures don't constitute epilepsy at all. They are actually like fever. Like if I get malaria या मुझे कोविड होता है तो एक लक्षण है फीवर आना. वैसे ही जब भी ब्रेन को कुछ अचानक से ब्रेन की बीमारी हुई है, कुछ नुकसान हुआ है, धक्का पहुंचा है, तभी जो फिट्स आते हैं, they are not epilepsy. वो मिर्गी नहीं कहलाते हैं. So then what is epilepsy? It's still the same short circuit, but the short circuit which happens when the brain is all fine. कुछ भी अचानक से प्रॉब्लम नहीं हुआ है ब्रेन को. इनफैक्ट वो बच्चा स्कूल में बैठा है या बड़ा आदमी है तो बस स्टॉप पे खड़े हैं, मीटिंग में है, पार्टी में है, घर पे बैठ के टीवी देख रहे हैं, नॉर्मल चीजें चल रही है लाइफ में, एंड अचानक से बिना कुछ अचानक ब्रेन का संतुलन बिगड़ने के लिए ऑब्वियस कोई कारण नहीं है, एंड उसके बावजूद भी अचानक से शॉर्ट सर्किट होता है और बाहर से अंदर शॉर्ट सर्किट होता है, बाहर फिट दिखाई देती है, उससे हम एपिलेप्सी कहलाते हैं. सो दैट टेंडेंसी, दैट प्रवृत्ति टू कीप हैविंग सीजर्स which are unprovoked, the brain is all stable, all fine, and just out of the blue that short circuit happens and you experience a seizure, that is what, and if you have a tendency for that to happen, that is what is epilepsy. So the diagnosis, no, actually, Chitra, is clinical. It's this history, these points that I've said, we try and elicit it in the history, in the story of the patient, कि क्या हुआ, कैसे हुआ, क्या देखा. So the eyewitness account is so important. So very often I'm calling the tuition teacher, I'm calling the grandmother, whoever was with the child, to understand ki exactly hua kya. Because is that eyewitness account, the story of what happened, bachcha tabhi kaisa tha, kya kar raha tha, is the main thing which helps us in diagnosis. Sometimes, of course, we do tests like an EEG, which is like an electrical map of the brain, very simple test. Just like your ECG, which you do for the heart, but a more complex one than that. Sometimes you do an MRI or other scans. Sometimes you do blood tests to look at the chemicals, to look at the genes. But the main crux of the diagnosis lies in the actual story, or as we call in medical terms, the history, the clinical history of the patient. How do we treat it? Oh, we are now really blessed. In the last 20 to 25 years, बहुत सारी नई एंटी सीजर मेडिकेशन, मतलब फिट ना आने के लिए बनी हुई दवा. There has been lot of research and progress in that, and we have a lot of options of anti-seizure medications. Why has that been important? So 50 साल पहले दवा नहीं थी क्या? Of course 50 साल पहले भी दवा थी, बहुत इफेक्टिव दवा थी जो फिट्स को अच्छी तरीके से कंट्रोल कर पाती थी. So क्या बदला है is how the medicine is tolerated, the side effect aspect of it. So जो पुरानी दवा है, as we call it, they are very effective in controlling the seizures, but have a lot of side effects. They make you feel dull and drowsy, requires a lot of monitoring and so on. So the new medications are such that they control epilepsy, but don't really affect the other functions of the brain. डल नहीं रहेंगे, कंसंट्रेशन में फर्क नहीं पड़ेगा. सो दवा लेके स्कूल जा सकते हैं, काम पे जा सकते हैं, ड्राइव कर सकते हैं अगर एपिलेप्सी वेल कंट्रोल्ड है तो. ऑफ कोर्स इंडिया एंड ड्राइविंग इज समथिंग आई एम गोइंग टू टॉक अबाउट लेटर, बट द पॉइंट आई एम ट्राइंग टू मेक हियर इज दैट it doesn't affect rest of the brain functions, the newer medications. So they're very easy to use. Why is this again important? Is because seizures happen on and off. It's not that, if you have epilepsy, you're going to have a seizure every day. Even without medications, there are patients where the seizure happens once a month, once in 6 months, once in a year. So life has to go on. And this is one disease, Chitra, where it's a very black and white disease. अगर फिट आता है तो आता है, दिखता है बाहर से, नहीं आ रहा है तो नहीं आ रहा है. It's a very, very सीधा equation. The medications also काम कर रहा है तो दिखेगा कि फिट्स कंट्रोल में है, काम नहीं कर रहा है तो दिखेगा कि फिट्स नहीं कंट्रोल में है. अंदर से कुछ साइड इफेक्ट हो रहा है, लिवर खराब हो रही है, किडनी खराब हो रही है, चुपचाप से अंदर कुछ प्रॉब्लम हो रहा है, ऐसा ये बीमारी में नहीं होता है यूजुअली. So it's that way, it's a very, very straightforward disease to manage. There is nothing happening in the background which is hidden and which the parents or the family has to be worried about. So we treat it with anti-seizure medications. They have to be taken morning, evening, very often in children. They can be taken once a day in the older kids. And typically the duration of the treatment is long. It can be 3-4 years in some patients to lifelong. How long the duration of treatment will be depends on what is causing the epilepsy. किस कारण के वजह से epilepsy है. So epilepsy के बहुत सारे कारण हैं, बहुत सारे. Two main reasons, two main verticals की what causes epilepsy is one is genetic, मतलब नैसर्गिक प्रवृत्ति है, आपको प्रवृत्ति पैदाइशी ही है, फिर कोई भी उम्र में वो प्रकट हो सकती है, बट पैदाइशी प्रवृत्ति है. एंड दूसरा कारण इज ब्रेन आइदर ठीक तरीके से बना नहीं है, देयर आर malformations in the brain, और there has been an injury to the brain. एक्सीडेंट हुआ है, meningitis हुआ है around the time of birth, especially in kids. ऑक्सीजन नहीं मिला है, शुगर कम हुआ है, इसके लिए ब्रेन को नुकसान हुआ है और उधर दाग बन गए हैं. तो कोई भी कारण से ब्रेन में दाग बन गए हैं, स्कार्स बन गए हैं, मेनिंजाइटिस हो, एक्सीडेंट हो, शुगर हो, ऑक्सीजन हो, जो भी, उसके वजह से आगे चल के एपिलेप्सी दिखाई दे सकती है. तो ये दो मेन वर्टिकल्स हैं. तो ये कारण डिसाइड करता है कि एपिलेप्सी का ट्रीटमेंट कितने साल तक वो बच्चे को या बड़े आदमी को देना जरूरी है.
So that was extremely important and very clear how you explained that. What about all these, like you said, myths around epilepsy? How should we warn parents, but they should reach a doctor really in time and not try to do all the jhad punk that they try to do?
Yes. So, but Chitra, that applies for all diseases. It's not for epilepsy. I'm often reminded by a saying that my grandmother used to say in this regard. It's a Marathi saying. She used to say, "Pradnya, sonaraneच कान टोचावे." What she meant is an expert in that field, or somebody who's trained in it, really knows everything about it, is the person who should address that problem. So it's very important, honestly, no matter what condition you are dealing with, child, adult, it's always important to reach out to an expert. Then that expert could be a family practitioner if it's a simple problem, or if it's a very rare complex issue, then somebody like a neurologist, epileptologist, and over time the management has to be like a team. So that expert, then so in the pediatric context, say the child has epilepsy, then the neurologist or the epileptologist has to work with the pediatrician, with the family doctor and the family together. And to be honest, with the school, with the therapist if needed, so that the child gets best care. When this happens, the myths around epilepsy start getting addressed very automatically.
Yeah.
Because all the professionals are sort of talking to each other. So that really helps. But what? There is still a lot of stigma around epilepsy. I remember the same stigma when I was growing up. If somebody had TB, or somebody had cancer even at that time, it would be talked about in hushed tones. People wouldn't openly talk about it. I think now that for TB or cancer, I would like to believe that stigma is gone away. But epilepsy is still something that people are really, really ashamed of. They think it's their fault, or it's something that they've done wrong, or is their shortcoming. And this, by the way, applies across the board, across socioeconomic strata, across the rural-urban divide, across educational levels. It's going to be a long road to address trying to get away, trying to hack away at that stigma around epilepsy. The moment that stigma is overcome, it becomes easier. So we run these epilepsy support group meetings, and the stories that patients tell, typically, the adolescents or the adults feel confident to talk about their own journey with epilepsy. And the stories that I've heard, how patients very, very indirectly are made to think by their own family कि ये उनकी गलती है. Because of them, the family को मुंह दिखाने की जगह नहीं रहेगी, that kind of a thing. And it's not something that's said overtly, but the actions of the family. The child is told, किसी को बोलना नहीं है, ऐसा होता है, किसी को बोलना नहीं है तुम दवा लेते हो, पिकनिक के लिए नहीं जा सकते, स्लीप ओवर के लिए नहीं जा सकते, इतना क्या दादी नानी के घर रहने को नहीं जा सकते, because even the immediate family hasn't been involved in the whole process. So that is how far-reaching the stigma is and influences parents or the family's reactions. And unfortunately, the indirect message that the kids get is that they are at fault, And I have had families and kids where the epilepsy is cured. I've stopped the medication. I've said, great news, you don't have to meet me ever again. And if I happen to meet them at a later meeting, support group meeting or whatever, I don't see those kids achieving the potential that I thought they had from an IQ perspective. And I think what pulls them down is the psychological hit that they've had. They think they're inferior. So they don't develop the confidence that would have just automatically developed otherwise. And also on a more serious note, if you don't talk about epilepsy, you never meet the experts, you never take the right medicines. So the, Baba and Angara and the Fukna and all that happens. Epilepsy can be a life-threatening condition if it's not managed correctly. Not just by virtue of the seizure, but imagine you get lost for a few seconds and you're crossing a road. The seizure might be a very subtle one where nobody can even realize that you are having a seizure. But you're crossing the road in the classic Indian style of zigzagging across, dodging vehicles, zigzagging across the road, and you get a seizure. The chance of meeting with an accident is so high. The seizure is a few seconds and just comes and goes away. But you will meet up with an accident. So right from that to a big seizure, which can, compromise breathing, oxygenation and all of that. So it's important that the epilepsy is recognized and treated correctly. And again, the stigma or the shame around it stops people from reaching out to doctors, forget experts. So it hits you in all possible ways, right? From a very practical aspect of the seizures not being controlled and the safety issues that come with it, to the long-term psychological hit that the kids get.
What you said, Dr. Pradnya, was so important, and I'm sure that it's going to help a lot of families, a lot of parents who are listening to understand how they need to talk about this to their own children, as well as to all the family members and to the entire community around the child, so that the child truly achieves, the potential as you rightly shared, and they don't delay in terms of reaching a doctor, and they don't feel ashamed, and they're able to do whatever is required to address this specific problem. And they also are able to figure out that, when there is a medicine to be given, it is treatable completely, then they need to actually reach the true professionals really urgently with their child. Thank you for sharing this. This was really, really, I think, one of the most important things that people need to hear. Moving on, I wanted to ask you, there are so many neurological problems, right? Especially in children today. And epilepsy comes as an add-on, feature with a lot of the diseases, disorders, you name it, everything. How do you handle this in terms of, questions from parents when they ask you that when my child becomes an adult, how should I handle this? What should I be looking forward to? What happens in that case? Today I'm coming to you. What will happen when my child becomes older? Can you please answer this?
Very, very pertinent question, Chitra. I actually worry about what will happen to my patients as they become older. Why I worry about it? It's not that we don't have the medical capabilities to look after them. But why I worry about is because how are children who have any chronic condition looked after as they make that transition to adolescence and then adulthood? That vertical of medical care is called transition care. It if you think about it, it's very intuitive, and it should exist across all specialties, whether it's a child with childhood onset diabetes, or a liver condition, or epilepsy, or other neurological diseases like cerebral palsy, autism, and so on. Because a child becoming an adult is a very biological process. The bodies change, the challenges, the requirements, even the parameters, everything changes as the body makes those changes. Importantly, the brain undergoes a lot of changes. So the best way to handle this is using the principles of transition care. And unfortunately, Chitra, we don't have that concept at all in the way our medical system works in India. So ideally, how it should happen is, as the child starts approaching 16, 18 years of age, the pediatric specialist, say for example, the pediatric neurologist and an adult neurologist, of course, an adult neurologist who is interested in taking on transition care. So that adult neurologist and the pediatric neurologist should ideally meet with the family together. It should be like a joint consultation, start addressing the ongoing problems together, so that transition from addressing those problems as a kid to an adult starts happening. Why is this important? Is because, remember, there is a limitation in our medical training as well. Because when we train, we first train as pediatricians, then we do whatever specialty it is that we want to train. Yes, we've read about diabetes. Yes, we've read about sexual health risk. We've read about hypertension and so on. But that's been like a long time ago in our medical training. Not the most up to date with those aspects of adult medicine. Similarly, the adult physicians, especially say neurologists, they are not that well versed with managing neurological diseases which have childhood onsets, because they're really separate entities. So even for the doctors to work together, guide each other, train each other, really improves the quality of care to that child. Also, the family has been, plugged into their childhood doctor, their pediatric doctor for the longest time, feel very comfortable, are very synced in. And then suddenly they have to meet a new person, explain all the medical condition. It's difficult for that new person to get a nice hang of the whole clinical journey that has happened for so many years. So very understandably, the family doesn't feel very confident in doing this. And then, as you know, the family either keeps meeting the pediatric specialist, and I certainly have a few families like that, and I keep thinking, oh my God, I'm definitely underserving them. Or they make that uncomfortable change to seeing an adult neurologist or a physician, and then keep reaching out saying, oh, but this is happening, that is happening, they don't get it. So the best way to do this is using the concept of transition care, where the pediatric specialist, the adult specialist, and the family do joint consultations for a couple of years, and then the care slowly is eased out into the adult, onto the adult team. So even I worry about this, and I hope to be able to develop this aspect of medicine, at least in child neurology and childhood epilepsy. The other questions that I get from parents is just a very open question, Chitra, saying, "Kya hoga abhi aage?" And that one open question has so many layers to it. They are worried how they will physically manage the child. Very often kids with neurological disorders, they may or may not be able to walk. They may or may not be able to take care of themselves for day-to-day needs. They may or may not be verbal. They may have behavioral issues. So essentially, very often these could be children who are totally dependent on the parents for even the day-to-day requirements, forget being independent from a financial perspective. So very, very naturally, the parents are very anxious, saying, how do we even deliver the day-to-day care? Because so long we were young, we were fit, we were able to pick up the child and do whatever was needed. But how do we do that as the child becomes physically, they grow bigger, they weigh more, they become taller than the mom or dad often, but the understanding or the behavior still remains, in inverted commas, childlike. So how do you engineer it? Plus the question around how do they manage the ongoing costs? Because so if they have to manage a child with different abilities, they need help. They might need the help of a therapist or a special school or a residential care home, or somebody who comes home, is like a 24-hour help who would look after the child instead of them physically doing it. Plus the cost of medications if there's an ongoing disease, plus the cost of investigations on and off, plus the cost of hospital admissions if they're needed, because the parents are now going to retire in a few years, stop earning, and then how do they solve for all this? So the question I get asked is that very broad question saying, "Aage kya hoga?" What will happen when he's 20, 30, 40 years old? But it has the practical aspect of delivering care on a day-to-day basis, and the financial aspect of it. So we like to start talking about this very, very early on, by 10, 12 years of age of the child. I have to say I'm often met with very quizzical glances back from the parents saying, why is she talking about this now? Isn't that far away in the future? Wo jab bhi hoga tabhi dekha jayega. But I don't think that approach really helps the family, because all this requires a lot of planning. Why? Because we are not a social welfare state. On paper we are, but we have very limited services from the in inverted commas government or the society, where these families are helped with ongoing day-to-day care to managing the finances in the long run. So I do think, unlike abroad, I do think in India parents have to start thinking and about these questions a good 10 years in advance, and start planning for them. Thankfully, most families still have a large family. They have siblings, cousins. So they say, oh, the day-to-day ongoing care will be taken care of. We still, in India, thankfully, we are a very service-oriented society. So we still are able to get help of trained or untrained carers to look after our kids and our elderly too, actually, in a home-based sort of a model. We really lack, sheltered workshops, residential care homes, for adults who are differently abled. And I think that is the next big movement that needs to happen for that to occur. There are residential care homes, there are sheltered workshops, but they are a few here and there. It's not a systemic thing that's happening in our society. Next comes the financial aspect. And of course, I'm not at all an expert on the financial aspect, but I do nudge the families to think about it, possibly form a trust, talk to your CA, talk to people like yourself, Chitra, and your organization, which would give them ideas as to how to plan from a financial perspective. But we definitely touch upon this very, very early on.
Thank you. And, there are parent support groups finally to handle this. Those, as you rightly mentioned, I am a classic case where I'm still stuck to my pediatric neurologist, Dr. Udani, and we haven't transitioned yet. And thanks to Forum for Autism as a parent support group, there are the older parents who have handheld us and have answered these, pertinent questions. And thank you so much for guiding so many families. I'm coming to the last question, Dr. Pradnya. As a neurologist, how best do you feel can we encourage society to accept different neurological conditions in individuals?
My God, I wish I had like one answer to this question. It's such a difficult uphill task. Um, I would like to fall back upon appeals. Saying we've always been such an inclusive culture. We're so proud that historically we accepted anyone who came to Bharatvarsh or India as it existed so many years ago, and we just accepted and just moved on. Whoever came, apna bana liya kind of a thing. There is really no reason why we shouldn't continue to have a culture which is empathetic or accepting or inclusive in the very same philosophy, saying okay, somebody looks different, or somebody doesn't have the same physical abilities, or somebody's behavior is slightly different, or they get seizures on and off. uh, so what? I think we sort of need to start making that as almost as a like a mantra, saying so what. And but I think it needs to start with the families who are affected, because uh, getting the society to accept these children or adults is yes, a very important task, but very often I find that the families only haven't really accepted these individuals. So it has to start at home, and then hopefully the society. So I think the best way is to just keep talking about it. Like today, you and I are talking about it. Now we are blessed with this huge, amazing instrument of change. I hope social media, which we can use or harness in the right way to keep talking about all sorts of neurological conditions, and keep sending that message or the mantra out of inclusiveness, apna bana lo. There is really no need to set them out as being different. What I find has been very encouraging is the acceptance of patient support groups. So, patient support groups can truly be a movement by themselves. I've seen that happening in tuberous sclerosis. I've seen that happening in Duchenne's muscular dystrophy, in some autism groups abroad. They have really, really managed to do everything that needs to be done around that disease: advocacy, fundraising, research, providing facilities in different geographies to be able to manage that respective condition. And in the last 10 years, I'm seeing increased uptake of that concept of a patient support group for various diseases. When I came back, there were very few. I think Forum for Autism in Mumbai was the one that we could fall back upon. But there's so many other diseases, Down syndrome, so many other syndromes, epilepsy as a large neurological heading. There were just no proactive support groups, and people weren't joining them and being part of them, and working to help that community. But in the last 10, 12 years, I'm definitely seeing more patient support groups coming up, which are very local, at a city or a national level. They are doing a lot of activities. A great success story recently was, so I'm involved. We set up the Tuberous Sclerosis Alliance about 5 years ago in one of the conferences at Kokilaben. And it's so heartening to see how it's grown. And I have to say, the real work has been done by the parents. So a little example was, we required a medicine which is the most important medicine for tuberous sclerosis. It's an anti-seizure medicine called vigabatrin. When I came back to India, all the vigabatrin we had used to be, in inverted commas, smuggled. It wasn't openly available in India, though it's FDA approved and all of that. So in the last 3-4 years, the TSC Alliance has managed to do advocacy, and now we have not one but two Indian pharma companies manufacturing the medicine in India, and it's readily available. What a game changer that has been. So I think getting the society to accept who's the society, it's people like you and me, and it's our families. So the moment we accept it in ourselves, start talking about it, start working around it, it will have to be a ripple effect with respect to acceptance at a larger scale. So parent support groups, patient support groups for different diseases are, I think, an important tool that we were missing out on so far. Harnessing the social media. These are, I think, a few ways wherein hopefully we will get better than where we are right now.
Absolutely. Thank you. I think, yeah, with the entire community support is where we'll be able to reach to, generally ensure that we are an actually inclusive society. Thank you so much for sharing your thoughts, your entire journey, bringing all your efforts to light. You have done so much and you're so young, and so I'm sure you're going to do a lot more. Right from the advocacy, just listening to you, how you reached out to those 8,000 teachers through COVID. And, maybe I hope you have the strength to replicate your Dahanu program all over Maharashtra. It was amazing listening to all of that. I really appreciate your passion for your work. And I'm aware of the superb facilities, that you're working with your team to set up at SRCC. And that should bring the state-of-the-art facilities to all of your patients. I hope this podcast will be heard by many to understand epilepsy per se and all the efforts that have gone in and will need to go in for a better future for our children and the society. Thank you very, very much for your time and wishing you all the very best, Dr. Pradnya.
Thank you so much, Chitra. I'm very, very grateful to you. And like I said, you are one of my inspirations. So, and Forum for Autism. So keep doing the great work that you're doing. Whatever help we can give you as medical professionals, would always be so happy to lend a hand.
Cheers to that.
You were listening to the Special Needs Children podcast with Chitra Iyer, the CEO of MFA and a trustee with the Forum for Autism. If you find this podcast relevant and interesting, it will be great if you leave a review, share, like and subscribe. You can also let us know if there is any specific topic that you would like us to cover. Feel free to email her on chitra.iyer@myfinad.com, or you can call her on 9833785892. That is 9833785892.